What is the current status of mental health and addiction here in Canada compared to 20 years ago? By Abraham A.G. Sandy. The current status of mental health and addiction in Ontario has gotten worse over the last 20 years, doubled from 2.6% in 2012 to 5.6% in 2022, age range of 15 and up here in Ontario. Addiction and toxicity of drug supply has caused a mass increase in deaths. Between 2016 and 2019, 15,000 deaths occurred to opioid consumptions here in Ontario alone. Where do you see the current situations 20 years from now? Honestly, I think that in 20 years from now, we'll be in a much worse situation with mental health and addiction that we are currently. More people are losing their jobs. More people are having no jobs at all. And more people are not making enough money to pay for things in society nowadays. Which means that more people are going to be out on the streets and more people don't want to feel such pains, so they'll turn to drugs. People nowadays aren't really close with family either. So a lot of family aren't really a backup at all. Locally, you can see the crisis with homelessness and drug addiction rise in St. Catharines, Niagara region especially. What stigma is your group currently facing? Workplace fear. Workplace fear is one person don't want to talk to any coworkers or HR or even to like seek help because they feel like them trying to reach out can lead to them getting fired. And 40% of parents say that they will not talk to any neighbors or they won't even talk to doctors, some doctors at all, if their kids are abusing substances. And substance abuse is also a really big stigma as well. Discrimination is one of the major factors of a minority not going to seek help because they feel like they won't be connected to as much. What services organizations are currently available in Canada? For mental health and addiction, there is Connect Ontario. There is also the Canadian Mental Health Association. For drug addiction, there is RAM, which is Rapid Access Addictions, and 811, which is non-emergency contact from nurses. What services or organizations are currently available locally here in Niagara region? Positive Living Niagara, St. Catharines. Withdrawal Management Detox, St. Catharines. CHMA Safe Beds Program. Distress Center, Niagara. These are all government backup and free organizations and great places for people to go to. And if you're suffering from anything, you really don't have to pay. They're really going to help you out and is government backed up as well. What support is currently provided by the federal provincial government? The federal provincial government has done a lot when it comes to showing effort having multiple resources that people can access to for free. 988 Societal Pipeline has free services that anyone can use that also has a bilingual agent for every service they provide. Youth Wellness Hubs have 32 plus locations across Ontario with many working with places like shelters, Start Me Up Niagara, The Raft, and more. All these are great for young youth. What do I believe are necessary to take improvements to better the current situation of mental health and addiction? Based on the articles that I have read and research that I've did, I've realized that homelessness, drugs, and childhood have been three of the main aspects of one, being mentally ill and having drug addiction. And I realized that we can start from a younger age, family-wise. The family could do better in raising a child and just being there, nurturing and loving. And the government can just be there by giving more free services and helping people.